there is 1,500 microbes, okay? Just think about, if this pen can hold that much bacteria, what your arms of your chairs, your shampoo bowls, and everything that you use in the salon is doing. And these are things that are critical. They're called blood-borne pathogens. And the blood-borne pathogens are transmittable once a cut occurs in the salon, whether it be on the hand, the neck, over the eye, and I'll get to that later. I'm going to take you through a blood spill, but I didn't need you to know that we're in the business of infection control. That's what it's called. And with that comes sanitation, disinfecting, and sanitizing. And of course, you must know how to prepare your students for a blood spill and how to disinfect it, okay? The CIB, which everyone has this listed on page 14, I believe. 14. Page 14. I'm going to be following exactly the same. It has a list of supplies that you must bring or that your students should pack with them. And also, it has the procedures. These procedures are what we use. These are posted in the salon, in the lab when your students come to take their state board exam. And we also have it on the nail table for the nail techs. It's right on the table. So there's no way that they can not read it and not pass, okay? The first step when the candidate comes in, we will read a set of instructions to them, telling them what they should do if they should have an actual blood spill. An actual blood spill must be put into the red biohazardous box. Also, there is a blood spill kit just in case they have an actual blood spill, because we don't want them to say, oh, I have a marked blood spill kit. What am I going to do if I cut myself later when they're doing a haircut or something else? The procedures then, after we show them all of this, and we tell them where everything should go, then we read them instructions for a marked blood spill. They have 3 minutes to set up. When they set up, they're going to put everything on maybe a paper towel, use paper towels, or one of these throwaway towels, or they can use a towel, but they must be able to put it all in one of these in a double bag, so I suggest paper towel. The products that they're going to be using are their gloves, which they put on immediately. That's the first thing that they're going to do. Assuming the 3-minute task is up, everything is here. Then we're going to demonstrate how to do a blood spill in 10 minutes. They will be read instructions that say you are to assume, if they're doing cosmetology, that your model has just been cut with scissors or a razor on the neck. And we point to the neck area. You are to perform the blood spill just as you would as if they had been cut. At that time, they should stop immediately. They have 10 minutes, and we set our timer. Put on their blood spill, put on their gloves. Assuming the 3-minute setup is stopped, and we've read the instructions, okay? The first thing they're going to do is clean the area. They can use cotton or a pad. And if it doesn't come into a tray like this, you should have applicators marked. We can clean with Q-tips, or we can clean with a cotton pad. I'm going to be using also should be antibacterial hand soap. And you can get some in packets sometimes. Clean the area. All of this must go into your bag that's trash. Okay, the next step is to apply an antiseptic or septic powder. Septic powder comes in a little container like this, or either you can get it in the little tubes. If you're using the powder, it should be like this and applied to stop the bleeding. Or you can use an antiseptic, and the antiseptic can be used on your cotton. And it can be applied to the cut or wound. That antiseptic, guess what? I touched this, so all of this goes into your trash. I also touch the septic. The next thing that we're going to do is cover it with a Band-Aid. And even this little paper should go in your bag. My next move is to get some hand sanitizer, some antibacterial spray. I'm going to remove everything that I've used. Make sure I put it all in my bag. Oh, wait a minute. I'm going to clean my tubes. Hold up. Now I want to pull up my razor. I want to make sure that either my scissors or my razor, my tubes are clean. Open them up. Make sure that on both sides, all through them, the scissors should be open. I'm going to be cleaning those. That's if I'm using a razor or if I'm using the scissors. You don't have to use both at the same time. The paper that I did that with is going into my antibacterial, my biohazardous bag. And they have been cleaned. Then go in they are immersed after clean into your barbicide jar or tray. All of everything that I was using just now goes into all of this is still going into the biohazardous bag. And I'm not going to shut it just yet because I have to clean my area. And that goes into the bag. My gloves come off. They go into the bag. The bag then goes into my biohazardous bag. And I don't want to shut it up just yet because I have to wash my hands with antibacterial soap. Hand soap, go over to a sink. We have a sink. Wash your hands in the sink. This should go into a trash bag. I don't have a sink in here, but this should go in the trash bag, and then the students can go over and wash their hands in, again, in the sink. Okay? Questions? Okay. Let me start over here and I'll work my way over. All right? Yes.
But instead of the
Can you name the